Harmony Health Clinic cares about you, and it is our mission to optimize your health. Feeling great is part of this mission. We do know, however, that pain is part of life. All of us to some degree will experience pain, and we want you to know that we are listening. And that is why at Harmony we are here to help manage pain. Pain has been proven to affect not only the body but the mind as well. It can cause depression, isolation through avoidance of activity, and a variety of mental health and psychiatric disorders. The treatment of chronic pain is complex. It involves time to understand a patient's social, cultural, and environmental context. All of these areas shape a patient's response to pain and how they think it needs to be treated. Moreover, the perception of pain varies from one individual to another based on past experiences and future abilities. Treating pain not only takes time, it takes accountability through a multidisciplinary approach for optimal treatment. Let's talk about first-line therapies that are safe and effective for most anyone. First, there's physical therapy, which involves stretching, yoga, and physical activity. Now, you probably saw this one coming, but here's why it works. Study after study demonstrates that staying physically active by stretching, performing yoga, and engaging in both cardiovascular and strength training prevents pain. It also prolongs our lives and prevents injury. If you can sit in a chair and breathe, you can do yoga. Be sure to check out our Harmony Mindful Movement series here on Harmonifi, which is coming soon. Even simple breathing exercises have been shown to improve hypertension and anxiety. Next are the over-the-counter medications. Studies show that Tylenol taken every 8 hours, whether you're hurting or not, decreases pain substantially. There's also judicious use of NSAIDs, which has been found to decrease pain as well. These methods should be discussed in detail with your provider as they may not be appropriate for you. Then there's steroids. Corticosteroids may be an option to decrease pain. Again, these options too may not be suitable for everyone and should be also discussed in detail with your provider. Next, there's neuropathic medications and muscle relaxers. These are widely prescribed medications to help patients cope with the effects of pain on the brain. They are very commonly used, but tolerance to side effects is sometimes challenging. Then there's pain management specialists. There is an option for a referral to a pain management specialist. It's important to note, however, that these specialists have gone through 1 to 3 years of additional training beyond medical school, residency, and training otherwise. They also have board certification in this specialty. They have spent years of their lives dedicated to treating the modalities of pain and all the dynamics surrounding this very complex field. They use a wide variety of modalities and procedures to treat your complex condition to ultimately give you the best way to manage your pain. Think about it. If you had heart failure, you would see a specialist, a cardiologist. It's the same way with pain management. Finally, there's chronic pain management. This is the least desirable option. At Harmony Health Clinic, generally we do not treat chronic pain. We follow guidelines and have rules which must be followed. Some of these rules are dictated by state law, and some are dictated by the Drug Enforcement Agency, or DEA. At Harmony, we care deeply about your health and your pain. Unfortunately, there have been so many patients in the past who have misused, abused, sold, or become dependent and finally addicted to pain medication. Some studies show that addiction occurs in up to 20% of people who start taking narcotics. This has created the opiate epidemic we now are having to deal with in our nation. Chronic pain is a tough subject to address, and it involves the mind, body, and even the soul. As a family practice clinic, we are not equipped to treat chronic pain. As mentioned previously, it takes a multidisciplinary approach from your primary care provider and multiple specialists to treat this very complex condition. At Harmony Health Clinic, our policy is to treat acute pain only. People desiring chronic pain medication will be referred to a pain management specialist that can best serve them and their needs. Moreover, we can also refer you for mental health services to help you manage the deep emotional effects that pain causes on the brain. One final word. If you feel you have become dependent or addicted to pain medication, there's a lot of hope for your recovery. Sometimes powerful addictions can ruin our lives. Here's some good news. There are treatment options for you as well. Please ask us if you need help in this area. Thank you. We will be with you shortly.